First question. Site of aqueous production is option A. Ciliary muscles, option B. Ciliary stroma, option C. Ciliary processes, and option D. Zonules. And the correct answer for the question is option C. Ciliary processes. Second question. In Schaeffer's system of grading, the angle width 10 degree means option A. Open angle, option B. Moderate narrow, option C. Very narrow, and option D. Closed. Correct option is option C. Very narrow. Next question. To which structure aqueous humor is not involved? Option A. Ciliary body, option B. Anterior chamber, option C. Posterior chamber, and option D. Posterior segment. Correct answer is option D. Posterior segment. Next question. Diameter of an adult lens is option A 6 to 7 mm, option B 9 to 10 mm, option C 16 to 18 mm, and option D 4 to 5 mm. Correct answer is option B 9 to 10 mm. Next question. Suprachoroidal space contains option A. Nerves, option B. Long posterior ciliary arteries, option C. Short posterior ciliary arteries, and option D. Above all. And the correct answer is option D. Above all. Next question. Nucleus contains option A. Newly formed fibers, option B. Adult fibers, option C. Oldest fibers, and option D. None of them. Correct answer is option C. Oldest fibers. Next question. At rest, radius of curvature of the anterior surface of lens is option A 6 mm, option B 7 mm, option C 10 mm, and option D 11 mm. The correct answer is option C 10 mm. Next question. Refractive power of lens is about option A 10 to 12 diopter, option B 8 to 10 diopter, option C 16 to 17 diopter, and option D 1 to 2 diopter. Correct option is option C 16 to 17 diopter. Next question. Area centralis is corresponds to visual field is approximately option A 5 degree, option B 10 degree, option C 15 degree, and option D 20 degree. And the correct answer is option C 15 degree. Next question. Total number of EOM present in both eyes are option A 10, option B 11, option C 12, and option D 6. The correct option is option D 6. Next question. In which type of cataract visual disturbance noticed in late stage? Option A cuneiform cataract, option B cupliform cataract, option C both, and option D none of them. The correct answer is option A cuneiform cataract. Next question. Excessive accommodation in hypermetropic patients without correction may cause option A esotropia, option B exotropia, option C hypertropia, and option D none of them. Correct option is option A esotropia. Next question. Infantile nucleus corresponds to option A 3 months of gestation till birth, option B birth to puberty, option C lens in adult life, and option D none of them. Correct answer is option B birth to puberty. Next question. What changes occurs during accommodation? Option A lens become more convex, option B anterior surface of lens changes its convexities, option C zonules are tense, and option D lens become flat. Correct answer is option B anterior surface of lens changes its convexities. Next question. Corneal transparency is the result of option A avascularity, option B peculiar arrangement of corneal lamellae, and option C barrier effects of epithelium and endothelium, and option D above all. Correct option is option D above all. Next question. In blue iris, anterior limiting layer contains? Option A, double pigment layer. Option B, triple pigment layer. Option C, few pigment layer. And option D, multi-pigment layer. Correct answer is option C, few pigment layer. Next question. Nerve fibers at NFL is? Option A, myelinated. Option B, non-myelinated. Option C, both of them. And option D, none of them. Correct answer is option B, non-myelinated. Next question. Road-free zone is? Option A, fovea. Option B, macula. Option C, peripheral retina. And option D, central retina. Correct answer is option A, fovea. Next question. Disconjugate, symmetrical, synchronous, inward movement of two eyes are called? Option A, convergence. Option B, divergence. Option C, levoversion. And option D, dextroversion. Correct answer is option A, convergence. Next question. Conjunctiva joins eyeball to? Option A, cornea. Option B, sclera. Option C, eyelid. And option D, eyelashes. Correct option is option C, eyelid. Next question. Which test is performed to check tear film adequacy? Option A, tonometry. Option B, regurgitation test. Option C, Schimmer's test. And option D, syringing test. And the correct option is option C, Schimmer's test. Next question. Orbital plate of frontal bone forms? Option A, floor of orbit. Option B, roof of orbit. Option C, medial wall. And option D, lateral wall. The correct answer is option B, roof of orbit. Next question. Eyelids consists of? Option A, 2 layers. Option B, 3 layers. Option C, 5 layers. And option D, 7 layers. Correct answer is option D, 7 layers. Next question. In which condition parallel rays of light coming from infinity do not focus into a point? Option A, myopia. Option B, hypermetropia. Option C, astigmatism. And option D, emmetropia. Correct answer is option C, astigmatism. Next question. If a patient is hypermetropic, then his posterior focal point will be? Option A, behind the retina. Option B, before retina. Option C, behind lens. And option D, on retina. Correct option is option A, behind the retina. Next question. Stroma of ciliary body formed by? Option A, ciliary muscles. Option B, vascular stroma, nerves and cells. Option C, collagen fibers and fibroblasts. And option D, above all. Correct answer is option D, above all. Next question. Which layer of retina forms blood retinal barrier? Option A, rods and cones. Option B, external limiting layer. Option C, RPE. And option D, NFL. Correct answer is option C, RPE. Next question. Which sign may be found in oblique astigmatism? Option A, closed eyelids. Option B, head tilt. Option C, face turn. And option D, watering. Correct option is option B, head tilt. Next question. Hard contact lens and toric contact lens are usually prescribed in? Option A, astigmatism. Option B, myopia. Option C, hypermetropia. And option D, above all. Correct answer is option A, astigmatism. Moving to the last question. A strongest prism with the base in will give the measure of? Option A, convergence. Option B, divergence. Option C, both of them. Option D, none of them. And the correct answer is option B, divergence. So please like, share and subscribe our videos. Thank you.